Time for a little wellness talk. You know, this works out well. You have Wellness Wednesdays. We ought to start calling this Wellness Wednesdays. Dr. Bradley Meyer.
Let's do it, Dave.
Yeah, Wellness Wednesdays.
Right on.
Speaking of wellness, any tips to breathe this Canadian wildfire air today?
Yeah,
It's
right.
pretty thick.
It is. It is thick. It's like, what's going on here?
Yeah, good thing you got the breeze.
No kidding.
Listen, the folks with allergies and asthma and that stuff, that's COPD. That's probably not very helpful.
Yeah, it's hard on them right about now. Anytime the air quality can be affected by these fires. So that's where, start thinking about what I can do from a avoidance perspective, which can be difficult at times, but to a treatment perspective. So coming into the clinic, doing things that help with inflammation. The red light therapy, extremely helpful for allergy symptoms, nasal congestion, sinus pressure, those kinds of things. So that's not only for allergies, but if you do have an acute sinus infection as well, sometimes those allergies will turn into a sinus infection. And we've been able to forego antibiotics for folks if we hit it early enough with some of these modalities. Red light therapy, for instance, is a great example of that. Sometimes we'll do pulse electromagnetic frequency pads. This is a pad that you sit on for about 15 minutes, and you can put one of the smaller versions right over the sinuses. Extremely effective at breaking up some of that inflammation in there and pressure.
So I want to talk more about that in a bit, but I want to start off with this.
Yeah.
You are beginning Wellness Wednesdays tonight at the Okoboji Clinic.
Yeah, come out, see us. We're going to be there from 6:30 to 7:30 p.m., and that'll be the time weekly. And we'll bring about different health-related topics, talk about different modalities we offer in the clinic in detail. Tonight, again, is going to be hyperbarics. So anything and everything you can think of about hyperbaric therapy. Is it right for me? What is it? How long am I in there? Is it safe? What does it treat? What's your success rate? All those questions. Then you can actually get into the clinic and look at the hyperbaric chambers. So we'll do probably about 30 to 45 minutes of my discussion about the history of hyperbaric therapy, exactly how it works, and then we'll get into some question and answer sessions of how it may apply to a broad range of health conditions, getting you back on the recovery, feeling better quality of life.
Yeah, and I don't want to steal your thunder, but one of the really amazing things about hyperbaric therapy, one of the learning tools was that it was learned for the troop. It was used for the troops because of brain injury.
Huge, yeah. Traumatic brain injury and PTSD. That neuroinflammation that develops after you have a brain injury, a concussion, will stay with you sometimes for days to months to years. And if that neuroinflammatory cycle is not broken, it can lead to a whole host of problems down site, and we call it, we don't want to let that train as it leaves the station get too much steam, because the more steam it builds up further down the track, the more difficult it is to get us back to balance in the body. So, we had an excellent example of a gal that came and saw our functional nutritionist and functional practitioner Ellie Stokey and Molly Avery, functional nutritionist, yesterday to talk about her constipation. And lo and behold, this goes all the way back, they found out, to a brain injury. And she's only 19, and she had sustained this not all that long ago. And so you hit the brain, and then you get concussion, inflammation. Brain gets scrambled, essentially, and it affects the signals. So we think the signal was affected to not only the phrenic nerve, but the vagal nerve, which then goes down to the colon and affects your ability to move byproducts, have bowel movements, essentially. And so, that was just the start for her. And if the right questions hadn't been asked to kind of peel back the layers, you're not going to kind of tie often constipation to a concussion. But the gals did that, and then they peeled back several other layers as well, finding that, we had been started on something, first speaking of allergies, Monty Lucas. Well, That can have an effect on serotonin levels, can have an effect on depression. And so then we added, not we, but as the medical provider, went the route, which, again, I've done plenty of times. When somebody comes in depression, you add on an antidepressant.
Sure.
But if the stomach is inflamed and not doing well, one of the biggest places where you produce serotonin, which is a neurotransmitter that makes you feel happy, is in the gut, in the bowel, in the small intestine, in that whole tract there. And so if that is injured, so we had a brain injury that was affecting the gut's not doing what it wants to do then as well. It's not producing those serotonin peptides which can affect mood regulation.
Sure.
So you have to get back to, how do we heal the gut? How do we heal the brain? Interrupt that inflammatory cycle, which then brings you back to some of the different modalities. Sometimes glutathione is a huge factor for brain healing. Nitric oxide, huge, but you have to get the right products. They have to be vetted because not all products were created equally. They have to be of good quality, and then you remove the trigger. So as long as there aren't continued knocks to the head, that's why those guys that they continue to play the athletics. Tyler Sash is a big one that I think of. That was not former Iowa Hawkeye. Unfortunate case. Too many. His bell was rung too many times, and then it's that brain just gets scrambled, inflamed. He would have done well on some glutathione, as most of us do. Most of us that have an inflamed gut have low glutathione levels, which is one of the biggest antioxidants that you can have and need to operate. And most of us across this great globe have low glutathione levels. So you see, this is kind of how it all comes together, and this is what we'll talk about on the Wellness Wednesdays. Different approaches, like we may hit memory one week, we may hit digestion another week. We may bring in a guest from the area that has a passion for, let's say, restorative farming, somebody that has, that grows organic microgreens. Who knows, kind of this health-focused approach. There's a lot of folks in the community and across the area that are very interested in it, coming out of this pandemic, because of where, we've learned that there's a multitude of different approaches to take, and that's one of the blessings out of this is people are looking for more than just one approach to solve a problem now.
I do think if there is an underlying positive, there is an underlying positive that people are concerned with their health and they want to be doing the right things about their health, and we're going to be out of time here. But one of the things that we need to delve a little deeper into is, for example, you talked about inflammation very early on here. For somebody especially aging like I am, we can feel inflammation. And you mentioned that that's fine, but you don't necessarily want to let this inflammation continue for another 10 years without treatment, because if you catch it early, then 10 years from now, the battle's not quite so hard.
Absolutely. Yep.
Yeah.
And most of us over the age of 40 are inflamed. And so if you see that smoldering fire starting, don't just always think ibuprofen. Let's find out what's causing the inflammation, see if we can tamp it down with some really good stuff for the body, whether it's hyperbarics, glutathione, some supplements, whatever it may be, that's going to be benefit. But then we're not getting down that head of steam with way down the track. So it's kind of a new concept, way of thinking, instead of just waiting for the engine to break down completely. Let's get on board early. Let's fix things right away.
Yeah, live well. Okoboji Wellness Clinic starts tonight. This is really cool. It's called Wellness Wednesday, 6:30 to 7:30 each and every Wednesday evening.
Right.
You'll talk about a various topic each week.
Right. Hyperbarics tonight, and we're right next to Ace Hardware in Spirit Lake off Highway 71.
And if folks want to give you a call,
712-339-6024.
Very good. Thank you, Doctor.
Thanks, Dave.
Dr. Bradley Meyer with us today, Okoboji Wellness Clinic. Again, 6:30 to 7:30 each and every Wednesday night. Talk about a different healthy topic.